Good morning everyone. I am Dr. Sandeep Tandel. I am a general and laparoscopic surgeon. This videos I am making for everyone, for understanding the problems people face, and when they come to OPD they have lots of doubts in their mind about the swellings or the surgical conditions they present with. So today's topic I have selected is a lipoma. It's a common problem. Most of the people have these issues, and when they get the swelling over the body, it can occur on any part of the body. So we'll start from the basic and we'll go into the details of it. What is lipoma first of all? So lipoma means it's a fat accumulation. Like when we say the fat, it's actually the fat which get deposit below your skin. So the lipoma means accumulation of a fat in one place, and so that it becomes a swelling. Usually we will have a fat layer below the skin, which will be in a single layer. It will be in a layer so that there are no unevenness over that part. So when the lipoma occurs, it's like a bulge you will see, a swelling you will be seeing in that part. It may not be painful, it might be painful depending upon the size, and all the factors are involved in it. So the lipoma. So lipoma, it can be a small in size or it can be very big in size. It can be single or it can be multiple. Multiple means people might have hundreds of lipomas in different parts of the body. So when you get a swelling on any part of the body, you should not ignore it. You should make sure that you are getting an opinion from an expert in that field, so that he rules out any problem with that swelling. Like most of the people, when they get a swelling, they have the fear that this swelling might be a problematic, or it might be a cancer, or similar doubts will come in your mind. So whenever you get a swelling, better to meet a consultant or the doctor so that he rules out what is the problem. So when you go to doctor with a swelling over your body, so if it is lipoma, what doctor will look into it? So the doctor will examine you. First of all, he will ask you the questions like when it started, what is the duration, like whether it is just one day it started, or it started 1 month back or 1 year back. The duration is important in this case, so the doctor comes to know whether the swelling has grown over the period of time or it has suddenly increased in size. All these things are very important. What is the speed of increasing the size of any swelling over the body. Then he will ask you whether it is painful or not. It's important to know whether the swelling is painful or not. If it is painful, that means it is disturbing your day-to-day life. So accordingly, doctor has to take decision about the swelling. He will ask you whether whether you have any other swellings similar swellings, or any other swellings other than that, because it is also having importance to know about number of swellings you are having on the body. Doctor will ask you like any other symptoms you are having, like if the swelling is on your hand or the leg, whether it is hurting while doing work or while walking, whether your day-to-day activities are restricted because of that. Any associated symptoms, like along with the swelling, whether you are having any fever, or you have any fever or vomiting, or any symptoms associated with that, so the doctor can come to a proper diagnosis. So once he asks you the various questions, then doctor will ask you to show the swelling. He would like to see the swelling so that he can do certain examinations. Now, what examinations you can expect from a doctor when you present to the doctor with a lipoma? So doctor first will examine. He will see exactly where the location of the swelling is, whether it is in the hand or the leg or on your tummy, on the back. The site is also important in every case. So when he sees, he will see the size, he will see the color over the swelling, whether the skin is normal in color or is there any color change. He will see the distance from the distance of the swelling, like from where to where it is extending. Then the doctor will ask you to lie down or stand or sitting. He might ask you to different positions to see whether the swelling is changing in size or not. Then doctor will request you, can he examine, can he touch and give progress, he can continue the examination part. So the doctor will first touch the swelling to see whether it is warm. The why warm or cold, it's important. If it is warm, that means it might be infected, it might be a acute condition. Acute means it has recently developed and there is either there is infection or there is underlying bleeding or blood or something might be there. So doctor will touch it, then he will simultaneously he will see whether you are having pain or not. So when he's touching, he might ask, is it painful or not? So that is also important. After that, doctor will try to check whether it is soft or it is hard in consistency. Consistency means whether the swelling is soft or it is hard. Then he might try to push it. In the lipoma, usually you push it, whether it is moving forward or not, that doctor will check. He might press it. When you press, whether the swelling is disappearing and coming back when he releases the pressure. All are these different signs doctor will be doing on the swelling to confirm that this is lipoma or any other condition. So once the doctor confirms on his clinical examination that this is lipoma, so what will be the further advice you can expect from it? If the duration of the swelling is like you are having the swelling from very long, it's not increasing in size, it's same size, like from last 4 or 5 years the swelling is just 1 centimeter, not increase, doctor will say that you can wait with this. It's a lipoma, it's benign. Benign means it's not cancerous, so it will not grow, it may not spread anywhere. So he might say you to observe the swelling. Observe in the sense every monthly you need to see whether the size is increasing or not. So it's important, if the size is growing continuously, steadily, it's better to take that swelling out. That means it's not stable. Okay, so if the swelling is painful or if it is increasing in size, doctor will advise you to remove it. So remove it in the sense you have to take it out. The medicines usually don't work on the lipomas. Like people have lots of doubt that whether because of they have eaten lot of the oily food or fatty food, that's why the lipoma or the fat deposition has occurred. So you need to modify your diet. It's always better that you have a healthy lifestyle and healthy diet. But after you get a lipoma, the modifying diet will not help in shrinking in size, because this lipoma, this fat which has accumulated in one pocket in that area. Like when fat get deposited underlying our skin, there are the multiple small spaces where the fat will get deposited. In lipoma, what happens is this all spaces clump together and becomes a circular, it becomes a swelling over there. So before proceeding with the treatment, we confirm the diagnosis of swelling as a lipoma based on the medical history, physical examination and imaging test. What imaging test you can expect is ultrasonography of that area or MRI sometimes if the swelling is large in size. Also sometimes doctor might ask to do FNAC or FNAB. What is FNAC? Fine needle aspiration cytology or fine needle aspiration biopsy, which is done in case the swelling is large and rapidly growing in size to rule out any underlying cancer inside it. Now the treatment for lipomas is mostly the surgical treatment. Either you can go for liposuction or excision. Excision means the removal of the complete the swelling, complete swelling with the sac, with the bag. I can say in common language, we call it as a sac. Sac means it inside a one complete sac like a bag, and you need to take it out completely so that it doesn't come back again in that place. Okay, so that is a surgical way of treating it. So when we remove it, if the swelling is very small in size, so you can expect a very small incision on that area, whichever area it is. Doctor will preferably put a absorbable stitches, because as the lipomas are most of the times are not infected infective conditions. So we can remove it and put the stitches over there, absorbable stitches. Depending upon every doctor, he will decide whether to put absorbable or non-absorbable stitches. Then what you can expect, the patient will have a doubt whether this will be done under local anesthesia or general anesthesia. So if the swelling is small in size, we will go for the local anesthesia, and if it is larger in size, like sometimes lipomas are very big, 10 centimeter, 15 centimeter. They can occur in different parts of the body, and even the patient fear is important. Some patient can't tolerate pain at all. In such patients, because of the anxiety and the fear, that we advise to do it under anesthesia, general anesthesia, so that the patient is comfortable. He's lying down calmly. The surgeon is also steady with the procedure, and he can remove it completely. Small swellings, local anesthesia is okay if patient is okay to undergo local anesthesia. Other doubts which people ask about the swellings, like after the procedure, what to be expected. Once the procedure is done, most of the lipomas are done under daycare procedure, so you can expect to go same day. Most of your work will not be affected because of that. If it is smaller in size, you can go back to your work depending upon your pain tolerance. Like some people can tolerate the pain will not be that much in case, because doctor will be writing you some painkillers also. If size is small, usually pain is significantly less. If the big size is there, then only the pain will be more. So in that condition, doctor will give you painkillers. He might advise you to take a rest also. If there are observable stitches, doctor will ask you to meet him like after 7 days or 8 days, just to see whether the swelling is healed or not. Sometimes it happens that stitches may not heal, and there might be some swelling just below where surgery was done. That happens because the fat, surrounding fat, the normal fat, sometimes can get liquefied and get accumulated over there. So that the secretions or that fluid has to come out. So if you after surgery, if you see that there is another again same place any swelling is coming, do not get panicked. Just meet your doctor. Your doctor might just remove that fluid which has collected over there, and then it will heal naturally after that. In case it is infected at that time, doctor might give you the medicines, antibiotics for the better healing in that area. Few more things I would like to add. What I spoke about was a single lipoma, like a one small swelling, but there can be multiple swellings. In that case, you are having multiple bumps or swellings over the body, and patient have a doubt that whether to remove all of them or not. So in that case, if we are having a multiple lipomas, like more than 100 lipomas or significant number are there, doctor will not advise you to take out all. In that case, we take a decision depending upon the size of the swelling, whether it is painful or not, if it is increasing very fast, and which swelling is troubling the patient most. So in that accordingly, we take a decision of removing that many lipomas, because you have multiple lipomas. Putting incision on every part will give multiple scars, which cosmetically will not look good on any patient. So considering that, doctor takes a decision. I hope all of you understood the condition called as a lipoma. If you have any doubts, you can post in the comments. I would like to clarify the doubts more clearly. Thank you very much for listening to me. Have a good day.